educators received 44 hours of education on topics such as diabetes, hypertension, and techniques on teaching classes and motivating clients. As a part of their education, they also had to do competency testing and live presentations for their classmates.
I decided to be in this program because I have diabetes type 2. And at first it was like scared. I was sad and mad at myself because I thought that I didn't take care of me and my family. The impact was great. It was huge. But the program helped me to understand that we can live a better life with diabetes.
Diabetes has major complications. It can affect blood vessels in the brain, can cause strokes. In the eyes, it can cause diabetic retinopathy that leads to blindness. In the heart, it affects major blood vessels, makes the arteries clogged, and you can have heart attacks.
I would describe Project Dulce as a class that's very engaging, and we work to empower patients so they can manage diabetes on their own, in a very interactive setting. It's a good place to learn and really hands-on training for patients to manage their diabetes.
Merced County's self-monitoring blood pressure strategies include providing blood pressure kits to all county library branches for checkout. This February, as part of Heart Health Month, staff promoted these kits at each of the 13 Merced County library branches, including the library's bookmobile, which reaches unincorporated areas of the county without access to a library branch. A total of 42 visitors to the libraries engage in learning to measure their own blood pressure. 3 pharmacies in Merced County also offer blood pressure monitoring. Merced County Lifetime staff is convening a group of 15 residents from Merced, Planada, Livingston, Atwater, and Winton. To date, the group has convened a total of 5 times. Residents are educated in the following topics: Public Health 101, review of the Merced County Community Health Assessment, high blood pressure, prediabetes and diabetes, and healthcare access. Future plans for the network include CHWs from Livingston will assist in healthy retail efforts in Livingston and Delhi, work with clinics to develop a training curriculum for all CHWs, and identify strategies for reimbursement. In 2014, the Merced County Department of Public Health trained 16 lifestyle coaches from various organizations. Of those organizations, 3 are actively facilitating diabetes prevention classes throughout Merced County: Merced County Department of Public Health, Livingston Community Health, and Golden Valley Health Centers. In 2017, Lifetime staff was successful at working with Merced County to begin a worksite wellness program for all county employees called Wellness for You. The Wellness for You program is designed to promote a healthy lifestyle related to the 8 dimensions of wellness: emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. The program includes twice monthly email blasts to all employees with health and wellness resources, lunch and learn events that feature guest speakers on various topics, and events and challenges that will promote a healthy lifestyle at the office. This is a big win for the Lifetime team, as 1,950 employees will benefit from this worksite wellness program.
So we start with some data around diabetes, and then we move on to prevention. And so for the diabetes section, we have information about the YMCA's Diabetes Prevention Program and a downloadable referral form for providers, as well as resources for referring to diabetes prevention programs and screening patients. And then we have information about Prevent Diabetes Stat, as well as, again, a list of a resource list, and a further link to our other focus areas. For community members or patients, we wanted to make sure that if a community member came across this website, that there was going to be information that was directed towards them. And so we start with some information, some general definitions around diabetes, and then we give specific links for what can you do if you have prediabetes and what can you do if you have type 2 diabetes. And then similar to our other pages, we have resources around diabetes. However, for the community pages, we made sure to provide English and Spanish resources, as Monterey County has a high population of monolingual Spanish speakers. And same for the hypertension, the definition, some strategies to control your blood pressure, and then some resources in English and Spanish. So that's a quick overview of the Prevention First Monterey County website. You can check it out for yourself at preventionfirstmontereycounty.org.
About every 40 seconds, someone in America has a heart attack or stroke. Stroke ranks number 5 amongst death, and stroke is a leading cause of serious long-term disability.
We're laughing, we're celebrating, but this is not a joking matter. Used to seeing them participate. They had high blood pressure, hypertension, they had diabetes, and so I thank God that Be There San Diego and the REACH program, it has never been about money. It has always been about passion. And even within our own church, we stopped selling fried chicken and bacon, and we have healthy foods.
When you've seen someone young, the breadwinner of a family, have a stroke, it doesn't only affect them, it affects the whole family. So one of the things we had to do was get the word out to the community. If you do have a stroke, you need to come to the hospital early. And I can tell you, TPA, it can be magical if it's administered in the right time frame. There's evidence of mistrust and miscommunication, and that it's widespread. This is not an isolated problem. But when I'm called to a room when a family is livid, mad, the first thing they tell me is, he didn't care, she didn't care, she wasn't compassionate. So first we have to deal with ourselves and look ourselves in the mirror, and then we also, as leaders, have to deal with the people in our practices.
doihaveprediabetes.org website is extremely popular. And again, we've got a lot of good information for people who are at risk, where they can go there themselves, or you can use this as a clinical resource.
We have embarked on sort of embracing a group of best practices surrounding the following issues: undiagnosed hypertension and self-monitored blood pressure, team-based care, the growing challenge of prediabetes.
We at Sharpless Daily, we have 47,000 patients diagnosed with hypertension. The philosophy, as all of us have, is that we are trying to really make sure that patients take ownership of their health. And basically every patient who's enrolled in the program receives daily messages around exercise, diet, medications.
We have about 65,000 patients, 275,000 visits. 99% of our patients are below 200% of the federal poverty level. That is our greatest disparity right there. And even on top of that, we still have 9 to 15% of our patients that have no insurance.
Being immigrants from Ghana, West Africa, we having the American dream of owning our own business. After we moved from Houston, where we had a lot of African and Caribbean markets over there. When we relocated here in 1993, we didn't see any of the markets here. So we started the store in 1999 to have authentic African to grow from a basic product that we sell here to a more healthy food. What we decided to do is have a facelift at the store so that we can attract more customers and have an environment that they'll feel at home.
In San Joaquin County, we've had the excellent opportunity to do great work on all 15 strategies of the Lifetime of Wellness program over the past few years. The following are a few highlights of that work. We have a small sample of some of the retail work we have been able to accomplish. Through our subcontractor, Health Education Council, we have created signage in both English and Spanish to alert community members as to where they can find fresh fruits and vegetables, but we have also implemented quite a few changes to store environments, including the overhaul of the produce displays, store cleanups, and much more. In an effort to help create a healthier workforce in San Joaquin County, we have developed walking path signage for employees to utilize on their breaks or at lunch. These map boards, along with accompanying map cards, allow employees to know how far they've walked and approximate calories burned. Along with each new path, we have conducted a kickoff event with Kaiser to promote the use of the paths and educate employees about the benefits of remaining active through walking. So far in San Joaquin County, we've hosted 2 walking symposiums, targeting the older adult population, and we are in the process of planning our 3rd annual symposium now. Utilizing the expertise of California Walks, we have been able to offer these half-day symposiums that focus on educating the public about the problems, equipping them with potential solutions, and encouraging them to go out and get involved in their specific communities across the county to create a more walkable environment for everyone. Moving on, to accompany the diabetes prevention program efforts in the county, we, along with our media and marketing subcontractor, created a provider promotional material in order to raise awareness about prediabetes and promote DPP classes. Next is a picture of the cover page of our Lifetime of Wellness Provider Toolkit, which we handed out to all counties at last year's convening. This toolkit is a compendium of best practices for chronic disease prevention using electronic health records, health information technology, and population health. Last July, we put on a forum entitled Serving from the Heart Across the Workforce. This forum focused on the role, integration, and sustainability of the work community health connectors do in San Joaquin County. In September of 2017, we arranged the training Bridges Out of Poverty for student and community pharmacists that focused on social determinants of health and the impacts that they can have on a patient's health. Finally, we have created blood pressure kits utilized in the Lifetime of Wellness blood pressure pilot. This pilot is implemented in 4 community-based organizations where 2,644 blood pressure screenings have been provided to San Joaquin County residents. This is a brief snapshot of what we've been able to accomplish with the Lifetime of Wellness program grant over the past few years. We hope you enjoyed it.
Today is National Diabetes Association Alert Day, and Shasta County is alerting its residents to an alarmingly high amount of residents that are considered pre-diabetic. Over half of the residents in the county are considered pre-diabetic, and 70% of that number will develop diabetes in their lifetime. Action News Now reporter Spencer Joseph is live with details on these shocking statistics. Spencer.
Debbie, and those numbers are very shocking, but the county and other organizations are taking notice of the issue, and they're starting programs to help turn those stats around. Shasta County is known for having gorgeous scenery and wide open spaces to exercise and stay healthy. But according to the county, half of the adults are facing a major health crisis.
If you look at diabetes, it's 50% of our Shasta County residents are pre-diabetic, and then you also look at physical activity. Less than 50% of people are being physically active for 30 minutes.
You heard it right. Half of the adults in Shasta County are pre-diabetic, and it's not just locally. Across the nation, it's no secret that diabetes has become a huge issue.
We can see that this is across the states, that we've seen a huge increase in diabetes, and it kind of correlates with the health. So you have less people being physically active, people are eating more junk food.
We've all heard of diet and exercise to stay healthy, but what it really comes down to is simple lifestyle changes.
So it's not anticipating, I'm going to go to the gym and do my 1 hour exercise. It's actually adding exercise to your daily habit.
That's why the Shasta Family YMCA is working with the county in order to start a program to fight diabetes.
The program is a CDC recognized program, and the goals of the program are to lose 5 to 7% of your weight and increase your weekly exercise.
And for the county and the YMCA, it's really about providing the services that get people to take those first steps to get back in shape and live healthy.
That really is a lifestyle change. So what we're talking about here is healthier eating, more activity, things that we all maybe know we should do, but we don't always do.
I would always say the first step's gotta be small changes. A lot of people think big and then it becomes just a little too overwhelming.
Hi, I'm Kirby Brooks, Health Education Specialist with Solano County Public Health, your Health Promotion Community Wellness Bureau, also known as Vibe Solano.
First of all, we know that diabetes and prediabetes is a very common problem and a serious problem in the United States. We know that 1/3 of Americans have prediabetes, and more than half of people in California have diabetes or prediabetes.
Vibe Solano, brought to you by Solano Public Health, is here to work with our community partners to make Solano a vibrant and healthy place to live, learn, work, and play. One of our projects is Healthy Stores for a Healthy Community. We are asking store owners to switch to healthy checkouts so that we can end our shopping on a healthier note. One of the stores that wanted to change their checkout to include better-for-you snacks and drinks is Bob's Liquor and Food.
99.7 Classic Rock wants to help beat chronic disease in Tulare County, where 1 out of 2 adults is pre-diabetic or diabetic. Possibly me, you, or half of everyone listening. So check your risk at testyourBloodSugar.org. Answer 7 simple questions with a yes or no, and see right away if your risk for pre-diabetes is low, medium, or high. If your risk is high, consider getting a blood sugar test right away. This is April Sky with a message made possible with funding from the Centers for Disease Control and Prevention.
Y cuando empecé a venir aquí al programa, nos empezaron a dar qué comer, cómo comer, cuánto deberíamos de comer sin dejar de comer, sino en porciones pequeñas, pero comer de todo. Entonces, pues ahorita estoy bien, ya no salgo ni prediabética.
This is the Lopez's house, an average family with an average lifestyle. This is Francisco, a great father, son, and husband with some little health problems. This is Teresa, his wife, a very, very busy teacher and housewife. This is Martin, the typical teenager. This is Simon, the little rascal. And this is Doña Dolores, the abuelita. Together, from now on, they'll start living a healthier life, an extraordinary life.
Today, Teresa and her sister want to bring Miguel to the health fair, but he doesn't show up. Not believe it, but there are people that can help all around you.
My name is Chris Burke. I'm 62. I'm a teacher in Soledad, California. I knew I had a problem. I knew I was a candidate possibly for diabetes. I used to sit around in front of the TV and eat chips chased down by soda and getting no exercise, and that was sort of like committing suicide slowly. It's so easy to do bad, and that's why I think this program makes a difference. It stops me from doing the same things I've been doing all the time. Signing up was very, very easy. I went to the website, soleraforme.com. The program that I picked is sort of a unique combination of both online and in person.
Once I made the commitment to this lifestyle program through Solera, my life did a 180 pretty much immediately. They gave me a few different options for my lifestyle program. It's really good to have different options that work for your life. On a daily basis, the virtual community and app that I use keeps me connected. That's been my lifeline.
The well-integrated screening and evaluation for women across the nation, also known as Wise Women program, is a CDC-funded program that contracts with select federally qualified health centers to provide low-income, underinsured women that are 40 to 64 years old who are enrolled in the National Breast and Cervical Cancer Early Detection Program and who are at risk for cardiovascular disease with the knowledge, skills, and opportunities to improve their health status to prevent, delay, or control cardiovascular disease. In California, Wise Woman is also known in Spanish as Corazón de la Familia, or Heart of the Family. The Wise Woman program utilizes health coaching and motivational interviewing to at-risk women in the clinic setting, which is vital to influencing behavior change to prevent or control cardiovascular disease and its risk factors. Health coaching sessions and motivational interviewing is designed to guide clients in developing skills that lead to, among other things, improved nutrition, smoking cessation, and increased physical activity. Health coaches recently received a fun-filled motivational interviewing refresher training session, which is a sustainable activity that could be used in other settings beyond Wise Woman health coaching.